All right, so this video today is all about soft tissue therapy, and that's how I define it, and that's how we're using that here. So what that is it's taking that that wider view and that sort of umbrella term of soft tissue care, and I think that this is something that can really help people. This is something that was, I guess, kind of born out of selfish origins. It was something that I'd experienced that I felt like there's a little bit of a gap between the massage therapist, which is here, and then you sort of jump up to the next level where you've got the physio, the chiro, and the osteo. And in between, there seems like just a little bit of a gap because the massage therapist specializes in dealing with soft tissue, that's for sure. But then on the other side of this gap with the physiotherapist, the chiropractor, and the osteopath, neither of those three are really specialists in soft tissue treatment. They do soft tissue treatment, they also do good soft tissue treatment, and I'm training to be a chiropractor, so it's I'm sort of biased towards that side, of course, but I did feel like there's a little bit of a gap between going and getting a massage and just feeling as though there needed to be a little bit extra on top of that, just to expand the options in terms of thinking and being able to rule things in and rule things out and just expand the mindset for what could be at the root cause of a problem or what's involved in causing that pain. There's only so much that can be done during a massage therapy session when someone's laying on a table. That's quite a limiting scope in terms of what the therapist can treat. And so we need to be able to move beyond that a little bit and have some more tools available to be able to assess more appropriately, to be able to give a report back to the patient on, I think that this is what your problem is and this is how I propose to treat it. Now, as a soft tissue therapist, we don't have as many tools to go to. Our scope of practice is limited as opposed to the professions up here. But I believe that by adding those extra layers and sitting in this middle ground, we're still a little bit further ahead than your traditional massage where you will go and lay on a table for an hour or so. So that's the gap that we're looking to be in. And I think this is really important because there's a need for it. At least, well, I hope there is, because otherwise I'm making a huge error. But so far the data supports it. We're doing about 2/3 of our bookings are for soft tissue therapy. People understand what it's there for so far, and having that delineation between going for massage therapy and going for something more specific, that seems to be resonating with people, and that was the intention. So I'm really glad to see that working. And I think it's an important option to have. So that's kind of a little bit more about that. These sessions are typically shorter. They're just with the nature of what we're doing. It's not appropriate often to work on something in the same time frame that you would for a massage, for instance, which is much more general and covering a lot more ground. We're often zeroing in on something. And that may be more than one area because it's related, but there's a certain capacity there that we have to respect, and so we get in, we do our job and get out again, and sort of do everything around that to package up that patient experience. But it's about doing what's appropriate, and sometimes it's appropriate to do nothing. I mean, that's a whole nother thing, but that ability to be able to recognize what's appropriate in that setting and for that patient, and to support them and to give them the help that they need, that's also a big part of what we're trying to do. So look, I hope that sort of helps to explain it a little bit. I'm not getting really deep into technique and things like that. What I will say is that this is all generally done by hand, and we do some dry needling where that's appropriate, and that's not always appropriate, but it's there as a tool. We're not using stimulators, we're not using lasers, we're not using whatever else. We're expanding on tools that form the base through massage, and you know, I think massage therapists have great hand skills and great palpation skills, and you know that it's so important to be able to have that, to be able to recognize and to be able to feel things in tissues and in the body. So we're taking that and expanding on that to zero in on a problem, and hopefully not just treat the symptoms, but be able to recognize what's behind the symptoms and what do we actually need to treat to get you a lasting result. So I'm just going to cut it there today so that this doesn't go on for too long, because otherwise I just talk forever. So hope that helps. If you like this video, go ahead and smash that like button for me, and see you on the next one.